Welcome, everyone. This is Dr. Edward Kondrot, and the webinar is entitled The Big Lie in Glaucoma Treatment. And I want to thank all of you for tuning in for this very important webinar. A little disclaimer before we begin. Glaucoma is a very serious disease that can lead to blindness, and this webinar is only for informational purposes only. The advice given in this webinar is no substitute for your continued care with your eye doctor. And I want to emphasize that you should not stop your eye drops and begin any of these treatments unless you first discuss this with your doctor. So my gift to you for attending this webinar is a free copy of my best-selling book called The 10 Essentials to Save Your Sight. And much of the material that I'm going to talk about in this webinar will be included in this book for a reference source. And you'll be getting a copy of this book at the end of the webinar. So who am I? I'm the only eye doctor to be board certified in ophthalmology and homeopathy. I'm the author of 5 best-selling books. I'm the host of Healthy Vision Talk Radio, and you're welcome to join me every Sunday evening. I have a medical license in 4 states. I'm the past president of the Arizona Homeopathic and Integrative Medical Association, and I'm the clinical director of the American Medical College of Homeopathy. My conversion, I began as a traditional board certified ophthalmologist, and I felt that there wasn't any eye disease that I couldn't take care of by cutting. And then my life was changed when homeopathy cured me of a very severe case of adult onset asthma. It's kind of a wake-up call for me, and I've been integrating alternative therapies in my practice since 1990. Because of the success of my program in treating people with chronic eye disease, I was featured on national television. Martin Sheen did a special production called In Focus, dealing with the methods that I'm using to help people with chronic eye disease. So if you've been told nothing can be done to improve your vision, you must take eye drops, and if you don't have surgery, you'll go blind. Well, I want to show you treatments that can help you now to save your vision. So as I mentioned, glaucoma is a very serious disease. Can lead to blindness if untreated. And it is unlike macular degeneration, which very rarely leads to blindness. So I think we have to take every possible approach in order to treat glaucoma. The numbers are going up with glaucoma. Primary open-angle glaucoma has increased by 13.8%. The percentage of glaucoma suspects have increased, and also the percentage of narrow-angle glaucoma is increasing. And there's many reasons for that, but I'm really not going to go into those during this webinar. So let's talk about the big lie. Let's look at an iceberg. The tip of the iceberg is the way that traditional ophthalmologists treat glaucoma. They're mainly focused on the eye pressure. 7/8 of that iceberg, as you can see, is underwater. And this is where all the treatment should be based. The treatment should be based on the health of your optic nerve, and it should also be based on your general health. So glaucoma is much more than pressure. I think we have to look at the emotional state. There's been some good studies and indication that stress in your emotional state can contribute to elevation of your eye pressure. I also believe that glaucoma is a central nervous system disorder. And there's been some studies in the ophthalmic literature beginning to show that this is a central nervous system disease, not a disease of the eye. I think we also have to look at oxygenation to the eye, circulation, nutrition, and detoxification. So these are the important areas that we need to focus on. So my presentation is going to be away from dealing with the intraocular pressure and focused more on the nerve and the general health of the person. Now, if you look at the diagnosis of glaucoma, traditional Ophthalmologists diagnose glaucoma by elevated eye pressure. But there is a condition called low tension glaucoma. And I always tell patients that, you can go blind with a pressure of 10 or even lower if there are conditions taking place in the eye which are damaging your optic nerve, or you can have a pressure of 25 and higher and not have any damage to your nerve. So the way we should follow glaucoma, and most ophthalmologists do, is look for visual field changes, a loss of peripheral vision, and also changes in the optic nerve. So here we see a cross-section of the eye, and the problem occurs when pressure increases in the eye, and that pressure causes damage to the back of the eye where the optic nerve enters the eye. The tissue there tends to be thin and delicate, and high pressures will cause damage to the optic nerve. There are millions of little fibers called nerve fibers, and these run from each rod and cone in the eye to the optic nerve. When the pressure is elevated, these delicate fibers can die. This causes loss of vision. And there are ways we can adequately measure this nerve fiber, and this is recorded as a nerve fiber's thickness. And I think this is one of the most accurate ways of measuring the success or failure of your glaucoma treatment. And here we can see what happens on the left. This large white area is due to damage of that nerve fiber layer and atrophy of the optic nerve. Another way is by measuring peripheral vision. This is also an accurate way of estimating the extent of damage due to glaucoma. And this is a computerized field test which measures the peripheral field. And you can see on these examples, the black areas are areas of loss of vision. Now, the current treatment of glaucoma, at least part of it, I think, is crazy. As I mentioned, glaucoma is more than pressure. It's about the health of the optic nerve and the health of the person. So most of the treatments are being done to lower the pressure. So there's a glaucoma equation. On the left, we see the circulation of the optic nerve. And these are like little, you can see the little blood vessels going through the optic nerve. As the pressure increases, that causes a decrease in circulation. So there are essentially two ways of improving the circulation of the optic nerve. One is to lower the pressure. By lowering the pressure, it's like taking your foot off of a garden hose. You lower the pressure. You take your foot off the garden hose, there'll be more flow. Or the other way is work directly on the optic nerve. Try to find things that can benefit the optic nerve to improve the circulation of the optic nerve independent of the pressure. So here's the garden hose analogy. We want good blood flow to the optic nerve. Good blood flow is bringing oxygen and nutrients to keep the person healthy. So if we put pressure on the garden hose, if we push on it or twist a hose, that's going to slow the flow. So we want to do things to keep the blood flowing to the optic nerve. Now, unfortunately, eye drops do this, but they do it, I believe, in an unhealthy manner. There are many, many side effects of these eye drops, and many of you suffer from redness and irritation. There's also something called the honeymoon effect, that the eye drops will only work a short period of time, and then you'll have to take an additional drop. And then when that doesn't work, you may need surgery. So I think using eye drops is like treating high blood pressure by destroying red blood cell production. Now let me explain that. I think aqueous production in the eye is essential for the health of the eye. And a lot of these eye drops decrease the aqueous production, which I think is essential for some of the functions of the eye. So that's much like treating high blood pressure by destroying the bone production of the blood. Then, of course, we have other procedures to lower the pressure, like laser therapy. But unfortunately, laser therapy does work, but it's usually short-lived. And after maybe 3 to 6 months, you'll need an additional laser surgery. Then we have more aggressive treatments where we put stents and tubing inside the eye to lower the pressure. But all of these really don't treat the underlying problem, which is circulation to the nerve. So how can we improve the function and health of the optic nerve? Well, one way we talked about is lowering the pressure. Now, I'm going to focus this talk on some other ways. One is by reducing inflammation, by reducing toxic effects on the nerve, by increasing cellular activity or the health of the cells in the eye. Also by increasing circulation, increasing oxygenation, and by ways that have a neuroprotective effect or neuroregenerative effect. By neuroprotective, I mean ways that we can protect the neurological system, and neuroregenerative is by ways we can help the neurological system to regenerate. Now, I know many of you have heard this before, but I really believe that food is our best medicine. 70% of your diet should be organic, raw, and living. You know, heat destroys a delicate protein structure. Heat also causes loss of amino acids and digestive enzymes, which are essential building blocks. Amino acids are essential building blocks to the body. So the more you can eat raw, organic food, you're going to be much better off. There have been many studies that show that organic food has more nutritional value than genetically modified food or processed food. And in addition, organic food has much less in the way of toxic heavy metals. There's dangers of genetically modified food, and unfortunately here in the United States, we're embracing genetically modified food. And in many European countries, genetically modified food is banned. And if you really do your research on this, you'll find out that genetically modified food is fraught with many, many dangers. There's also dangers of processed foods, pesticides and chemicals, which are destroying our health. So all these things need to be considered. And once again, I think food is our best medicine. You need to begin with a proper diet. Because of our poor American diet, many individuals are deficient in essential minerals. And I'm going to focus a little bit on chromium. There was a study done which showed that chromium is deficient in open-angle glaucoma patients. Normal healthy patients have about 279 nanograms per milliliter in their red blood cells. And you can see that in open-angle glaucoma, this is markedly reduced. Where can we find chromium? Well, chromium is found in foods that are very high in calories, like heavy cream, eggs, molasses, red wine and red grapes, and fat in red meat. When I usually find an individual that's deficient in chromium, without question, they're usually deficient in many other minerals. And I think getting your minerals, your essential minerals to a proper level, not only chromium, but zinc, selenium, copper, molybdenum, all of these minerals need to be at a proper functioning level in order for you to have healthy cellular activity in your body. There are some simple ways of measuring not only chromium, but all your essential minerals. We use a device called an oligoscan. This uses spectrophotometry on your hand that can quickly measure the levels of all your essential minerals. There's another way, a taste test. And we have a chromium taste test to very quickly measure your chromium levels depending on the way that this tastes in your mouth. Because people are so deficient in minerals, often we recommend a Meyers Cocktail. A Meyers Cocktail is a highly concentrated vitamin formula which goes intravenously to really boost the essential minerals in your body. It's like getting vitamins in an IV formula. Now, in addition to the essential minerals, we have to look at toxic heavy metals. And there's been many studies to show that toxic heavy metals can adversely affect the optic nerve. when you begin losing your vision in glaucoma and you begin to have optic nerve damage, the optic nerve is much more sensitive to toxins. So those of you that are listening out there that do have damage to your optic nerve, you do need to have your heavy metals tested. And if they are elevated, they need to be treated. One of the best ways of testing for heavy metals is something called a 6-hour urine test. If you were just to check your urine without a challenge, it would probably be normal because these heavy metals don't go into your urine. They go into your brain, they go into your bones, they go into your fat. So you need to take a chelating agent and then collect your urine for 6 hours. And this is something we commonly see, that lead is elevated and often mercury. Now, one of the best ways to remove heavy metals is chelation with EDTA. EDTA is ethylene diamine tetraacetic acid, which is a large molecule which circulates in the body and binds the heavy metals and makes them soluble. There was a national study done called TACT, the TACT study, Trial to Assess Chelation Therapy. And this study proved that chelation therapy dramatically improves heart disease, especially those with diabetes. Now, the study really didn't look at eye disease, but one thing I have found that all of my patients who undergo chelation will get an improvement of their circulation. And remember how important I felt that it is to improve the circulation to your optic nerve when you have glaucoma. So chelation is a wonderful way not only to improve the circulation to your optic nerve, but also to get rid of some of these heavy metals that are toxic to the optic nerve. So EDTA chelation is a wonderful way of covering two of these harmful things that are adversely affecting your optic nerve, the decrease in circulation and heavy metals. Now, chelation therapy can be done many different ways. Probably the best way is intravenous, but it also could be done rectal, topical, and orally. And I would suggest that you do get a hold of an integrative doctor and find out ways that you can improve your circulation and ways that you can get this EDTA chelation therapy. Now, another way to chelate your body, and I'm an expert on this since I'm married to a wonderful Vietnamese lady, is Vietnamese soup. There was a study done in Vietnam that showed that Vietnamese have a very low incidence of heavy metal poisoning, especially mercury. And one of the reasons is that Vietnamese soup has a lot of cilantro. There are many alternative doctors feel that cilantro is one of the great ways of eliminating heavy metals in your body. So I would encourage you to grow cilantro on your windowsill, get fresh cilantro, make cilantro pesto, put cilantro in your soup and your salad, eat as much as you can. It's a wonderful chelating agent. Hyperbaric oxygen is another way of improving circulation to the optic nerve. There was a study done that showed that hyperbaric oxygen treatment typically causes a 5 millimeter drop in intraocular pressure. There's no question that it increases oxygenation to the optic nerve. There's another way, and that's called exercise with oxygen. And this is where you exercise with an oxygen mask at high flow. And this is reported just as effective as the hyperbaric oxygen. But most of us can't afford to go to a hyperbaric chamber or to buy the equipment for hyperbaric oxygen. And that's why I'm a big advocate of ozone therapy. Ozone uses a highly reactive form of oxygen, O3. This is a powerfully charged oxygen molecule. It increases oxygenation in your body. It reduces inflammation. It stimulates healing, and it helps balance the immune system. There's been a lot of research on ozone therapy done by Dr. Silvia Mendez from Cuba. There's a major hospital in Cuba, and all they do is ozone. All of Silvia Mendez's work has been done with rectal insufflation. So this is ozone, a small amount of ozone that is inserted rectally to help improve the oxygenation of your body. And she's done a study with over 200 glaucoma patients, and has demonstrated there was a marked improvement of visual acuity in up to 72% of these patients. There was visual field expansion. There was also a lowering of the intraocular pressure, an improvement of the visual evoked potentials. So these results demonstrated the effectiveness of ozone treatment to help the functional recovery of the nerve fibers in the eye. So in part of our program, our Kondrot program, we educate you on how to use ozone. And I love treatments that can empower you. And rectal insufflation ozone, once you buy the equipment, can be something that you can do daily at home. I also want to talk about microcurrent. Microcurrent stimulation is a big part of my practice. I was introduced to microcurrent by the great golfer Sam Snead when I read that he had a dramatic improvement of his vision. I read about this over 20 years ago, and I had the pleasure of treating him for a week, and in exchange, he gave me golf lessons. Now, microcurrent does the following things: increases circulation, increases cellular activity, reduces inflammation, reduces scar tissue, has a neuroprotective effect, and also stimulates stem cells. All of these things are exceptional for patients with glaucoma. I put together this information in the book that I published called Microcurrent Stimulation Miracle Eye Cure. So this is a very simple, non-invasive treatment that can wake up the optic nerve, lower your pressure, and improve your vision immediately. And you can see there's a patient up on the right, and this is how we administer the microcurrent through a conductive device that goes over the eye and the back of the head. There was a study published in the Journal of Clinical Orthopedics and Related Research, and this study showed that low levels of microcurrent can dramatically increase cellular activity by up to 500%. So what we're doing is we're taking dysfunctional cells and we're dramatically improving their function. And this is what we want to do. We want to improve those sluggish cells that are in your eye to get them to functioning much better. So microcurrent can do this dramatically. Microcurrent is widely used by athletes, treating injuries, reducing inflammation, and increasing the rate of healing. And there's a photograph of my wife and myself. We ran the Marine Corps Marathon, and my body was just aching. And after a 30-minute microcurrent treatment, I was amazed at how quickly microcurrent reduced the inflammation and took care of my pain. And it can do the same thing for your eye, very quickly reducing inflammation, stimulating healing and rejuvenation. This is an interesting study that was an animal study. They looked at the effect of microcurrent in a group of animals that had surgically induced glaucoma. And they discovered that the low frequency microcurrent had a neuroprotective effect in a subset of these animals. And the conclusion was that low frequency may be an alternative therapy in the treatment of glaucoma. So there have been several microcurrent studies that have been published looking at the effect in treating ocular disorders, retinitis pigmentosa, a study showing that it reduces intraocular pressure, and the one I just mentioned showing that it has a neuroprotective effect. And by neuroprotective effect, I mean it has an effect to prevent the progression of neurological damage. I have treated over 700 cases of glaucoma with microcurrent. I find that there's an average pressure reduction of 5 millimeters. Most of the patients treated had an expansion of visual field. They have an improvement of acuity and also an improvement of contrast. Now, dance and exercise can lower pressure. And there have been several studies to show that exercise a couple times a day can lower the intraocular pressure. So I encourage all of you with glaucoma to exercise. Exercise will stimulate blood flow to the eye and improve the function of your autonomic nervous system, and have a unbelievable effect on improving the health of your eyes. I want to talk a little bit about the work done by Dr. Bates. And when I was a resident studying ophthalmology, we made fun of Dr. Bates until I read the book by Aldous Huxley. Aldous Huxley, as you know, is a famous science fiction writer. He wrote The Brave New World and Doors of Perception. He also wrote a book called The Art of Seeing. Huxley had horrible vision, was going blind, and for a good part of his life, he had to use Braille. And it wasn't until he discovered the work of Dr. Bates that he had a dramatic improvement of his vision utilizing Bates's techniques. One technique that Bates talked about is palming. And I like palming because palming is a way that kind of is like meditation for the eye. In addition, there's an electrical current that goes through our hands. If you do Kirlian photography, our body is an energy system. And by putting your palms over the front of your eye, it's kind of like delivering a microcurrent. At the same time, it is relaxation, kind of like a meditation. Bates also talked about sunning, and sunning is a technique where you look at the setting sun and you close your eyes and you turn your head back and forth, and the image of the sun goes through your closed lids and you can see it on your retina. He felt that sunning was very protective of the eye and helped regenerate. Now, Bates was right about sunning. There was a study done that was published in the medical literature that showed that low-level laser therapy improves vision in patients with macular degeneration. And another study was done that this low laser treatment can reduce the intraocular pressure in the majority of patients. And it discovered that the intraocular pressure dropped much lower in patients who had glaucoma compared to patients who did not have glaucoma. So this is an example of the laser that we're using. We not only treat the eye, but we also treat the carotid artery on the side of the neck. And there's studies that show that by treating the carotid artery on the side of your neck, you improve the oxygenation of your eye. We also treat the lower leg, the long bone. Studies have shown that laser light is one of the best ways to stimulate stem cell regeneration. And one thing we looked for was a low-cost laser that patients could use. And we discovered that there's a company that manufactured, it's called the Delta laser, that not only does it have the red infrared light, but it also has a low-level pulse electromagnetic field, ultrasound, and syntonic light, and all of these in combination seem to have a synergistic effect. I have an interest now in something called the PK protocol. I've been studying with Dr. Patricia Kane, who's a nutritionist who believes that the neurological tissue can be reversed. And she's developed a protocol called the PK protocol. And she's doing phenomenal work improving patients with really severe neurological disease like multiple sclerosis, Alzheimer's, Parkinson's disease, and her key is giving them the proper lipids. And she believes that by treating the cell membrane, supporting the cell membrane, the neurological membrane, you can have reversal of neurological problems. And here's something that is really, this is just shocking to me. There are 100 million rods and cones in the retina, and each rod and cone has a stack of about 2,000 layers of lipid membrane. And if you would spread out all those membranes, it would be 40 square miles. That's 40 square miles of membrane. It would be like running a 26.2-mile marathon to run around this area. So improving the health of the cell membrane of the eye is key. And she's developed a very intensive IV lipid protocol using phenylbutyrate, phosphatidylcholine, glucophora, and glutathione. And she's also developed an oral protocol. And both of these protocols can have amazing benefit in regenerating cell membranes and improving the function of the eye. But also these protocols also help to remove heavy metals. So I'm kind of excited about these two new protocols. Now, believe it or not, that red beets are good for your eyes. Red beets are an extremely, really good source of dietary nitrates, which the body can convert to nitric oxide. And this is nitric oxide, not nitrous oxide. Nitrous oxide is laughing gas. Nitric oxide opens up blood vessels in the body, increases blood flow, and in addition, it helps to regenerate blood vessels. So I'm a big advocate of red beets. So nitric oxide performs the following functions. There's a big list of them. But if you look at the bottom, it improves blood flow to the optic nerve and improves the trabecular meshwork function, which results in a lower intraocular pressure. So I think nitric oxide, eat more red beets. There's a product that I really recommend called Neo 40. And you take one tablet, which dissolves under your tongue twice a day, and it's much like eating 6 red beets with each tablet. So you have the amazing benefit of nitric oxide in this tablet. I want to talk about an amazing plant. Before I tell you the name of this plant, this was extensively studied and published in the British Journal of Ophthalmology. And I believe that this plant could be the most amazing natural substance to treat glaucoma. Number one, it has been documented to lower pressure, reducing pressure by 50%. It also balances the autonomic nervous system. It has a neuroprotective effect, neuroregenerative, and an anti-inflammatory effect. And the name of this plant is marijuana. Now, I'm not encouraging all of you to go out to smoke marijuana, but there is a lot of research done in looking at the individual ingredients of marijuana to see what has the most effect in lowering intraocular pressure and having the neuroregenerative and neuroprotective effects. But I do believe that those of you that have extensive damage from glaucoma and you're not responding well to conventional treatment, I do think that this should be an option. Many states now are recognizing the medicinal value of marijuana. Another option is hemp oil. Hemp oil is made from hemp seeds, the marijuana seeds, and hemp oil has very low concentrations of THC, which is the hallucinogenic substance in marijuana. So this hemp oil, it does have some low concentrations of the THC, but it has an extremely high nutritional value because of its ratio of omega-6 to omega-3, which matches the balance required by the human body. So hemp oil may be an exceptionally good oil for helping to regenerate the eye. There's another substance called acetylcholine, and there was a study done looking at 41 patients with a diagnosis of progressing glaucoma, and they received acetylcholine for 2 years. And at the end of the study, the group that received acetylcholine had a much slower rate of visual loss. So this acetylcholine may have a neuroprotective effect in the treatment of glaucoma. This is my optic nerve support, which is specially formulated. It has the B complex vitamins, which are essential for function of the optic nerve, vitamin C, ginkgo biloba, and it has chromium, coenzyme Q10. It has coleus fuscoli, which is an Ayurvedic herb that is reported to lower the pressure. And it also has digestive enzymes, probiotics, and betaine, which are ingredients to help get these nutritional ingredients into the body. We also have a substance called the Ocular Function Spray. This is a liquid spray that's quickly absorbed into the body. So it kind of bypasses the irregularity or variable absorption of your gastrointestinal tract. I think one of the biggest problems that a lot of people have is that they're taking the right vitamins and nutrients, but it's not being absorbed into the body. So the ocular function spray is quickly absorbed through the mucosal lining of your mouth going into your bloodstream. We have a homeopathic glaucoma formula that works based on homeopathic principles, and this has been developed for the treatment of glaucoma. So improve your vision in 3 days. Well, 85% of patients who complete my program will have a dramatic improvement of vision. And this is the program that was featured on Martin Sheen's In Focus national television show. And the program's not for everyone. It's only those very serious and investigating and saving their sight. And my results of the program are going to be published in Alternative Therapies in Health and Medicine. This will be coming out later this year. I reviewed 152 patients that were treated using these alternative methods. And I just want to review the results, these published results on glaucoma patients. There were 29 patients with glaucoma. The average change in acuity after 3 days of treatment was 6 letters. That's greater than 1 line on the eye chart. There was an improvement in contrast and a drop in pressure of about 5 millimeters. And here you can see the visual field expansion, marked expansion in 37 eyes, moderate 14, no change in minimal. The pressure lowering occurred in the majority of people, but once again, I want to emphasize that, these therapies are not really meant to lower the pressure. All of these therapies I'm talking about is to look at the other side of the equation. The other side of the equation is improving the function of your optic nerve. Here is a dramatic visual field improvement. You can see the field on the left has a marked defect, blindness in the upper part of the vision, and after 3 days, complete return of vision. Now, we have many programs for you to choose. We have the traditional Kondrot Program, which is held at our Florida Wellness Center. This is actually a 1-year program. I've also trained about 20 doctors throughout the country who are now doing the Kondrot Program. We also have a Get Started with Microcurrent workshop in our office. This is a 2-day program. So please call the office if you're interested in one or more of these programs. All of them can benefit you. So the next step is to decide what program is best for you. I would encourage all of you to begin my glaucoma vitamin protocol. This has been something that I've been using now for the last 10 years, and I think this is essential to support the health of your eye and your optic nerve. But once again, this protocol is not to lower your pressure. It's mainly to give you nutritional support to help the optic nerve function. If you're really not sure on what's the best program for you, I would encourage you to go to my website. I have a 10 Essentials webinar. You can listen to that, or you can give the office a call or email us for more information. Also, I offer consultations. You can find out what therapy is best for you, and this can be done over the telephone. You don't have to come to our office in Florida, but if it is being done on the telephone, I do require that I receive a copy of your last eye evaluation within the last 3 months so we can discuss what are the best options for you. Also, my Sunday evening radio show at 5 to 6 p.m., that's Arizona time. So you can listen online at www.1100kfnx.com, and your questions are always welcome. And every Sunday, I have an interesting guest who's contributing something to alternative medicine and health, and also is really doing work and helping people and individuals with vision loss learn what alternative therapies are beneficial. These are some of my best-selling books. And as I mentioned, all of you for listening to this webinar will be getting a copy of my 10 Essentials to Save Your Sight. And we do have an additional special bonus. I'll be sending you a special report on the truth regarding marijuana and glaucoma. So right after this webinar, you'll be getting a copy of both of these bonuses. Now, we do have a webinar special. I really want to make it affordable for you. And this is my glaucoma protocol. So the optic nerve support, the function spray, and the homeopathic glaucoma tissue salts, all three products. The webinar special is only $127.90, which is over a $30 reduction. Please take advantage of this special webinar offer. Get started now on my glaucoma protocol, which consists of the ocular function spray, the optic nerve support, and the homeopathic tissue salts, and you'll save $32 on this webinar special. So call now, 800-430-9328 or 352-588-0477. You can also order online at www.healingtheeye.com/web glaucoma. You can also give the office a call if you're interested in having a consultation with me, or if you're interested in exploring our 1-year Restore Vision program or one of our other programs to get you started with microcurrent or to learn more about other alternative therapies. So thank you so much for joining me on this webinar. And this is Dr. Edward Kondrot wishing you good health and clear vision.